Our very relevant topic today is universal basic income. In 1971, the idea of a guaranteed annual income for all Canadians was the key recommendation in a Senate report on poverty. In the 70s, both Canada and the United States ran extensive pilot programs on basic income. In 2009, a Senate committee noting growing inequality and persistent poverty in Canada said it was time to put a guaranteed income back on the public agenda. In 2017, a basic income pilot project was launched in 3 regions in Ontario, and the pilot was canceled in July of 2018 by the newly elected government under Doug Ford. Social Services Minister at the time said that the project was expensive, unsustainable, and quote, clearly not the answer for Ontario families, end of quote. In the context of COVID, universal basic income is becoming a pressing issue and is being revisited by nations across the globe. And I'm pleased and excited to introduce our speaker today, Dr. Evelyn L, Professor of Economics and Community Health Sciences at the University of Manitoba. Professor Forget is one of the foremost experts on basic income. Her most recent book is Basic Income for Canadians, the key to a healthier, happier, and more secure life for all. She's often called upon by governments, First Nations, and international organizations to advise on poverty, inequality, health, and social outcomes. Welcome, Professor Forget. It's great to have you with us. Thanks for joining us. And over to you.
Thanks for that lovely introduction. You've just reminded me how long we've been at this story of basic income in Canada. I think that this is a really interesting time to be talking about basic income. There's been a confluence of voices. We're increasingly hearing from different groups in Canadian society who've begun to recognize how limited some of our social programs are and how basic income might respond to some of the issues that we face as a society. And so I'm delighted to be here today talking about why I think basic income is a reasonable, efficient, and useful response to some of the issues we face on an ongoing basis. When the economy closed down in response to COVID-19, we recognized a number of things very, very quickly. Many of us recognized for the first time how limited our social safety net is, particularly employment insurance. We already knew that fewer than 40% of the people who pay into employment insurance can actually expect to receive any support when they lose their job. But we learned a number of other things when COVID-19 shut down a number of firms. We recognized, for example, that people who are self-employed are really not supported very well by employment insurance. There was no provision for parents who had to stay home from work because the schools were closed and the daycares were closed. There was no ability to collect employment insurance if you were home because you were immunocompromised or because you lived with other people who had health concerns. So employment insurance really didn't meet the needs that we faced most recently due to the pandemic. As a response, the federal government rolled out a number of emergency responses for different groups of people. And these were important, they were necessary, and for the most part, they were really well delivered. But we learned a number of things as these programs were rolled out that I think are useful to a discussion of basic income. First of all, those programs don't cover everybody. When you have a number of different programs addressing different groups of people, delivering different amounts of money under different conditions, it's inevitable that some people end up falling through the gaps. For example, people who have depended on provincial disability support or provincial income assistance or welfare didn't receive any particular support through the CERB, for example. Their expenses and their needs may have grown during COVID because many of the programs they relied on depended on volunteers who were no longer available to deliver support, but they didn't receive extra help to meet their needs. But perhaps more importantly, in some ways, we also recognize that the way the CERB was designed made it inconsistent with reopening the economy. And this has become particularly relevant now as a number of provinces are starting to relax restrictions and firms are trying to reopen. We've heard from a number of people that employers can't hire labor. labor's not coming back. Now we know some of the reasons for that. In some cases, it's because there's no childcare available and children are still home from school, so parents aren't available to go back to work. We also know that some people are still facing health concerns. If employers can't provide, for example, safe workplaces, it's not reasonable to expect workers to return. But there are also particular issues related to the way the CERB is designed. As it stands, workers can go back to work and earn $1,000 and keep their $2,000 benefit. As soon as they earn $1,001, the entire benefit disappears. So if you put yourself in the position of a worker who's being called back to work in a restaurant, the restaurant owner is usually in no position at all to guarantee a minimum number of hours. So an employee doesn't have any idea how long they can be expected to work, how much they might be expected to earn. They might be in a position where they work and earn $1,500, for example, and lose the entire $2,000 benefit. So what that does is it shifts all of the risk associated with a bumpy reopening onto individual employees. That particular design feature is good if the intent is to keep workers home, but it's not very good if the point is to encourage workers to go back to work and the economy to reopen. And so that's one of the things I'll talk about in a minute when I get to basic income. But we find ourselves in this really unique position right now. The CERB is coming to an end. This was set up as a temporary 16-week benefit. And yet the economy is not entirely open yet. Some of the jobs that have disappeared are not going to come back. Some workers have no place to go. They could be shifted to employment insurance in some cases. In other cases, they wouldn't be eligible. So what do we do? What do we do with the workers who are relying on the CERB? Do we extend the CERB when we know that there are limitations in the way it's designed? Do we extend it temporarily and make certain changes to it? Or do we transform it into an ongoing benefit? And if we do that, what should it look like? And I think one of the things I'm going to try to do today is to argue that what it should look like is a little bit like a basic income. Basic income is sometimes a confusing topic for people because when we read about basic income, when we read Twitter, when we read a number of newspaper articles, it seems that many people are coming at this topic with very different definitions in mind. And it's really important to keep the design in mind and to think very carefully about what we mean when we talk about a basic income. One of the things that's happened in Canada in recent years is that there's been a tendency for many advocates of basic income to coalesce around one particular definition of a basic income. And so when people in Canada talk about a basic income, they usually see it as one component of a robust, responsive, comprehensive economic, health, and social safety net. A basic income includes universally accessible housing, childcare, education, pharmacare, dental, physical, mental health strategies. So it's not in any sense a replacement for public services. No sensible proposal in Canada for basic income imagines that basic income would replace all public services. Those services are necessary to life in a high-income country like Canada. Basic income is universally accessible, but not everybody receives a check every month. And that's what makes it distinct from some of the other proposals that you might see out there on the web, different from Andrew Yang, for example, and his proposal in the US. Not everybody receives the money. You receive a support from basic income only if you need it. It depends on your income from other sources. So if you're not working, if you have no income from any other source, you'd receive the full benefit. And the full benefit would be set somewhere near the poverty line. So it's sufficient to live a very modest, but still dignified life. If you go to work and you earn money, your benefit will be reduced, but it will be reduced by less than what you earn. So it gradually declines as your income increases until it disappears altogether at middle and higher income levels. And what that means is that basic income provides support to people with no income at all, people who've traditionally relied on provincial income assistance, but it also tops up the wages of low-income working people. People who are working at minimum wage, for example, who may or may not get full-time hours, who are still living below the poverty line, would receive additional support through a basic income program. So why do we need a basic income? First of all, to eliminate persistent poverty. If you look across Canada, every single province offers income assistance at levels that are far, far below the poverty line. Basic income would replace the stigmatizing, bureaucratic, insufficient levels that are offered by provincial welfare systems. Basic income would replace the complicated and confusing set of federal and provincial tax credits and deductions that are intended to help support low-income people. So things like the GST credit, for example, on your income tax. But basic income is not only about ensuring that traditionally poor people receive money that they require to live a reasonable life. It's also intended to provide an insurance policy for everyone. It provides economic security for people who don't now need support, but who might at some time, for some reason, find that their income has disappeared and they need support. COVID-19 is only the most recent example. Many people who never expected to be dependent on public assistance suddenly found themselves without income and required some kind of support. So what would happen if we introduced a basic income that looks like that in Canada, an income-based basic income? The first thing is that we know that basic income does not encourage people to stop working. We know this from a number of experiments that have been conducted all over the world. In Canada, we've had two experiments. The Mincome experiment in the 1970s that Anna referred to took place in two cities in Manitoba, the city of Winnipeg and the small town of Dauphin, Manitoba. Dauphin had about 10,000 people. It was an agriculturally dependent town, a small town like many other towns all across Canada. And a number of years ago, I went looking for the data from this experiment to see what we could find out about the consequences of the experiment. And one of the first things that we found out was that it really doesn't encourage people to stop working. Adults with jobs continue to work. There's very little response. Most recently, we've gotten reports from two experiments that took place in Europe, in Finland, and in the Netherlands, in the city of Utrecht. And in these two experiments, not only did people not stop working, people who received a basic income were more likely to transition to full-time permanent jobs than people who did not receive a basic income. There are groups of people in Canada who already receive a form of basic income. You can think of the Canada Child Benefit, for example, as a basic income for families with children under the age of 18. Analysis of that, of the response to the Canada Child Benefit, is that more women ended up working when their families received the Canada Child Benefit. So not only does basic income not lead to a reduction in work effort by people who receive it, in many cases it can lead to a better match and a more consistent attachment to the workforce. So how's that different than the CERB, right? We know that the CERB discourages people from working. My argument is that a basic income would, at the very least, not do that, but it might, in fact, encourage people to work a little bit more. And the response to that is that because of the way basic income is designed, because people who work are entitled to keep a larger proportion of the income that they receive from work, they're more likely to go back to work and to benefit from working as well. What are the other effects of basic income? One of the things that we know best about basic income is that mental and physical health improves. When we ask people who participate in the experiment, that's one of the most consistent results we find. And that's been the case in every experiment, every time we've offered a basic income. In the case of Mincome, we can go further than that. One of the things I was able to do with the town of Dauphin was to access the Medicare records of the people who lived in Dauphin during the experiment and compare their use of the healthcare system with similar kinds of people living in similar kinds of places who didn't receive a basic income. And what I discovered was that a basic income led to a reduction in hospitalizations of 8.5%. When I talk about improvements in mental and physical health, It's always a very positive thing to think that people's health improves, that people report they feel better. But in fact, it translates into very, very direct economic benefits as well. Canada is a country that spends currently more than $65 billion a year on hospitals. An 8.5% reduction in hospitalization leads to a considerable savings in healthcare expenditure. In the Ontario Basic Income Guarantee experiment, people again reported improvements in their mental and physical health. The same thing happened in Finland. The same thing happened across the world in low-income countries, countries like Malawi, Brazil, Kenya, and India. No matter where you conduct the experiment, people are happier, people are healthier, people go to hospitals less often, people visit family doctors less often. People use the money that they receive from a basic income to invest in education. That makes them more productive in the long run. It makes them less likely to be unemployed in the long run. That was the case with MINCOME. In MINCOME, it meant that more high school age students managed to finish high school, to graduate. And if you think back to the mid-1970s, you can imagine the very different kind of a life that somebody who finished grade 12, somebody who graduated from high school in 1975 might have had relative to somebody who dropped out early. If somebody left school at age 16 in 1975, they could certainly find a job. In the town of Dauphin, they would have ended up working in agriculture, working in manufacturing. And if you think of what's happened to those industries over the last 40 years, you know, farms that would have employed two dozen young men in 1975 have replaced them all with a very big machine, a very big combine. So employment in those particular industries, in manufacturing, in agriculture, has virtually disappeared over the past 40 years. So people who left school without complete high school in the mid-70s are much more likely to have experienced periods of unemployment, whereas people who finished high school, who graduated, in some cases went on to college or university, are able to offer very different opportunities for their own families. In the Ontario Basic Income Experiment, even though it only lasted a year before it was canceled, a survey of recipients told us that many of the people used the money to register in community colleges to get some job training. The same thing happened in many low-income countries. In Malawi, for example, it was found that girls in low-income families were much more likely to go to secondary school if their families received a basic income. So the way that people invest in income changes depending on the circumstances of the country where basic income is offered. But it's always the case that that education is seen as a good investment by the families who receive money. One of the most important reasons to offer people a basic income is because it improves their economic resilience. When people receive enough money to take care of their necessities, to ensure that their family has a roof over their head and food on the table, they're able to put aside money. They're able to plan for unexpected contingencies. They're much less likely to go to payday lenders, for example, to not be able to pay their debts. In the case of Dauphin, in the case of the MINCOME experiment, one of the things we discovered was that family violence tended to decrease. It's possible that criminalization might fall with the basic income. If we look at the reasons that people are in prison, 80% of women are in prison for poverty-related crimes. The most common reasons for jailing Indigenous women in Canada, for example, are poverty-related crimes, theft, fraud, drug trafficking. So basic income gives people the resources they need to live reasonable lives. It's particularly important for people who are moving through transitions in their lives. When you're making big changes in your life, you need dependable, predictable income. Newly sober people, for example, require non-judgmental access to income support. They need second chances. They need opportunities to get their lives back together and to change the way they are conducting their lives. People who are coming out of prison, formerly incarcerated people, need a basic income if they're going to not associate with the same group of people that they were associating with before they went into prison. If they're going to change their lives, they need an opportunity to make changes. Young people aging out of foster care require dependable and predictable support so they can make changes, so they can make plans in their lives and move ahead. People leaving violent relationships need support. They need the ability to make decisions about how they're going to live their lives and what they're going to do going forward. One of the things people are always concerned about when we talk about a basic income, and that's particularly relevant now, is whether or not we can afford a basic income. When Ontario introduced its basic income guarantee approach, the parliamentary budget officer was asked what it would cost if we took the Ontario design of a basic income and we offered it to Canadians all across the country. Now, the Ontario design was a modest basic income. An individual was guaranteed $17,000 a year, approximately, and they were permitted to keep 50% of any earnings beyond that. So if they earned $1, if they went to work and earned $1, their benefit would decline by 50 cents. If it was a 2-adult family, they would receive about $26,000, and anybody who was entitled to child benefits would receive that in addition for their child benefits. So it was a modest basic income. And the parliamentary budget officer looked at it, and he calculated that if it were rolled out across Canada, the net cost would be about $43 billion a year. It's a tremendous amount of money. But it turns out that provinces already spend $20 billion a year on income assistance. And the basic income was designed to replace provincial income assistance. So the net cost would be $23 billion a year in Canada. Can we afford that? Well, just to put it in context, we spend more than $23 billion every year to deliver the Canada Child Benefit, just slightly more than $23 billion. We spend more than twice that delivering pensions to seniors. We've decided we can afford both of those levels of support. So $23 billion a year is well within the realm of what a wealthy country like Canada can afford if we choose to afford it. It's a matter of choice. Now, some people have argued, in particular, the Basic Income Canada Network has argued that that's really too modest a program, that we can do better than that. We can offer people a more generous basic income. And so they asked, well, what would happen if we were to offer individuals $22,000 a year as a basic income, 2-adult families $31,000 a year, plus any child benefits they might be entitled to? And instead of reducing the benefit by 50 cents for every dollar earned, we'd reduce it by 40 cents for every dollar earned. That means you're offering a basic income to more people and you're giving them more money. Obviously, it's going to cost more. What would that cost? Well, it turned out that they discovered that they could be paid for. They could be paid for through a combination of tax fairness measures and by replacing current expenditures for things like the GST credit that would no longer be required. So they would eliminate non-refundable tax credits that currently benefit mostly high-income individuals. They suggested modest increases to taxes for high-income individuals and increases in the corporate tax rate, slight increase in the small business tax rate from 10 to 12%, I believe. And they discovered that they could more than pay for this more generous basic income program. So it's certainly possible to afford a basic income, but both of these costing exercises took place during normal times. They didn't take place during a pandemic. And I think it's really important to distinguish between the costs of a basic income as a permanent program and the costs that we're facing right now as a response to COVID-19, which are extraordinarily high. The current costs are something that we can afford, that we can deal with, but they shouldn't be conflated with the cost of a basic income as a permanent program. A basic income is affordable in the context of the Canadian economy. And just as a final note, I think I'd like to address one criticism that we often receive when we talk about basic income. A number of people suggest that what we really need as Canadians is not more income. What we need are better services. Guaranteed services would ensure that the people who needed those services would receive them. People would receive the services they needed for their lives, but we wouldn't just be giving everybody money, which they could spend on anything they wanted. Is that a preferable approach? Instead of focusing on basic income, should we be guaranteeing services to everybody? And I'd like to reiterate that no sensible proposal for guaranteed minimum income or basic income imagines that money alone is sufficient. We do need public services. And so to characterize the discussion as a distinction between basic income versus public services is a false dichotomy. I'm a strong believer in public services. But I think it's also important to recognize that public services work better for some people than they do for others. Public services are designed, implemented, and evaluated by members of the dominant culture. And that's one of the reasons why the report of the Commission on Missing and Murdered Indigenous Women and Girls recommended a basic income for all Canadians. Some people have dismissed basic income as a one-size-fits-all solution, but in fact, it's anything but that. As soon as someone has money, they can transform that money into services and goods that fit their particular and unique needs. So let me tell you a story about how healthcare works for an expectant mother from northern Manitoba. I live in Manitoba. It's my example. When a mother is 7 or 8 months pregnant, she's flown from a remote town, a remote community in northern Manitoba to a large urban center for the last several weeks of her pregnancy, alone, without family or friends. That's done to ensure that she has access to the technology and skills she needs if something unexpected happens during delivery. But she leaves her kids behind. And these kids are often staying with their grandparents, with cousins, with sisters, with aunties, with older brothers and sisters, sometimes by themselves. And you can be sure that she's worried about them. Meanwhile, the mother in Winnipeg or Thompson or Brandon is living without her family, without family support. But she does have access to support workers, and she does have access to a whole lot of healthcare workers. These workers very often will not share her family background, and their support and advice, unintentionally, sometimes runs counter to the way things are done in her community. The message she gets, unintentionally, is that there's something wrong with her and she needs education, or there's something backward about her culture and it needs transformed. Services can embody some of the patriarchal colonial attitudes that cause so much pain for Canadians who are not members of the dominant culture. Now, a basic income is not going to bring better healthcare to rural or remote communities in northern Manitoba. But what it will do is allow that mother who's accessing healthcare in the way we can deliver it in this province to take some of that money and to share it with her mother or her cousin or her sister who may be taking care of her kids. She could use some of that money to hire somebody to come into her house to take care of her kids so she doesn't have to worry about them while she's in the city. That money can be transformed into a plane ticket so she can bring her sister or her cousin to the city with her to keep her company during the last several weeks of pregnancy. It would even allow her to hire someone, to hire a doula from her own cultural background who can help communicate with the healthcare workers that she's dealing with over the last few weeks of pregnancy. We need services in Canada. Sometimes we need better services than we actually provide, but we also need money. Money that we can depend on, money that we can spend on our own needs, in our own way, and on our own timetable. Now, I hope I've convinced you that basic income is worth thinking about and worth talking about. I think I'd like to end with just a few suggestions about what might be done. I think it's really important that all Canadians enter this conversation, whether you agree with the concept of basic income or whether you don't. We're at a really pivotal time, I think, in terms of Canadian social programs. We recognize that what we have isn't meeting our needs. I don't think the status quo is good enough, and I think many people don't think the status quo is good enough. We need to do something going forward. We need to make changes. We need to ensure that people have access to the resources they need to live better lives. Instead of waiting until the consequences of poverty are felt, and trying to deal quite inadequately with the consequences of poverty through the healthcare system or through our other social programs. We need to take some of that money and invest it upfront in families, to invest it in people, so that they can provide the kind of lives that they need for themselves and for their families. I think that it's really important to move forward and to enter that conversation, and we can enter it in a number of ways. One of the ways we could do that is to think about some of the civil society organizations you're associated with. As you know, as many of you know, the Senate, about 50 senators have signed an open letter asking for a basic income in Canada. They've received support from a number of different organizations across the country, faith organizations of different types, various First Nations organizations, unions, business women's organizations, a number of different organizations. If your organization supports the concept of basic income, write a letter and let people know about it. Engage with your own member of parliament. I'd like you to tell them that we need a basic income in Canada, but even if you think we don't need a basic income in Canada or there's a better approach, make sure you engage and make sure that they know what values you're bringing to the question, because many of the decisions we have to make are based on human value judgments at this point. We need to make that known. And thirdly, I'd ask you to challenge some of the stereotypes out there. Challenge the notion that if we give people a basic income, it'll all be spent on addictions of one type or another. That if we give people enough money to feed their kids, they're going to stop working, because everybody knows that the only way to encourage people to work is to coerce them by threatening them with starvation if they don't do that. So challenge the stereotypes that we know aren't true, and engage in a serious conversation going forward about what kind of a social safety net we need in this country. Thank you.
Thank you, Evelyn, for the wonderful presentation. We'll go to questions now. And maybe I can begin by asking you the following question. So I've read that there are economists who believe that the total cost of current welfare systems is higher than the potential cost of UBI. And I'm thinking of Ontario Works, for example, that pays something like $700 a month, or ODSP disability payments in the range of $1,100 to $1,200 a month. Both of which are abysmal given the cost of living. So for example, an ODSP payment is barely enough to get you a room in the city of Toronto. And so this proposal where individuals get $22,000 a year, which is something like $1,800 a month, this is higher than both Ontario Works and ODSP payments combined. So can you explain that argument?
How we can pay for it at that higher rate?
Yeah, the argument that the total cost of current welfare systems is higher than the potential cost of UBI.
I don't believe that to be the case. I think that basic income will cost us additional amounts of money. I concur with the Parliamentary Budget Officer's claim that a basic income would cost us probably about $20 to $25 billion more a year than we're currently spending.
Right.
I do believe that that's something that we can afford in this country, but it turns out that our current welfare systems are really very inefficient systems. We spend an awful lot of money and an awful lot of time policing people. You know, many people who don't know very much about the way provincial welfare systems work don't quite understand the demands that are placed on individuals to provide paperwork. There's mountains of paperwork every month to document every aspect of their expenditure, their needs, and so on. And all of that paperwork has to be evaluated by somebody. And so we hire tremendous numbers of people to deal with the bureaucratic aspects of delivering welfare, because these systems are set up on the basis of mistrust. And I think one of the biggest differences between the emergency response benefit we put in place and traditional welfare systems is the emergency response benefit operated on the basis of trust. It decided to offer support to people based on the 99% of people who are honest and tell the truth, instead of worrying about the few people who inevitably, no matter what program is in place, will misrepresent their situation. Welfare, by contrast, treats everybody as a potential criminal who where everything needs to be validated before any support is offered. So I think that the approach of the emergency response benefit is a better one, and it's certainly a cheaper one. The idea is to give people the money that they need up front, and then wait to validate eligibility issues down the road. There's always an opportunity to recoup that money afterwards. So I think one of the ways that we save money with the basic income is that a lot of that bureaucracy we put in place becomes unnecessary. The other thing is that when you have a number of different programs that deal with different groups of people, if you have programs that support students, programs that support people with disabilities, programs that support people who are out of the workforce, traditional welfare programs, for example, other programs that address other groups of people for whatever reason, that bureaucracy is duplicated for every single program. So instead of the economies of scale that you would get by having a single program that deals with everybody, you're duplicating that bureaucracy, and that bureaucracy is incredibly expensive. So it's not a very efficient way to deliver welfare, and it also doesn't meet the needs of people. One of the things basic income would do would be to take more of the money that we're spending on the program and put it into the hands of the people who ultimately need it, rather than spending it on the delivery of the system.
Okay, here's a question from Erin. What is the most effective method of implementing a basic income on a municipal, provincial, or federal level? Or would it have to be a collaborative approach? And as a follow-up question, would basic income take into consideration things like the cost of living across different cities and available access to other public programs?
Yeah, that's a really good question. One of the things the federal government does really well is to raise money and spend money, but that's about the only thing it does really well. The federal government has the capacity to raise tremendous amounts of money through the tax system, and it can deliver money in a very efficient way. It's not very good at dealing with the needs of people in particular communities and delivering services on site. So one of the things a basic income could do, and I think a basic income should be delivered by the federal government. What that basic income does is it sets a floor across the country. It ensures that there's at least a basic level that all provinces need, that you get as a Canadian, no matter where you live. And then the provinces come in and the municipalities come in to deliver particular services or to address particular needs in a local community. So one of the things that we hear sometimes, for example, is the cost of housing in Toronto or Vancouver relative to the cost of housing elsewhere in the country. You can't deliver a basic income from the federal government at a level that's sufficient to pay the rent in Vancouver or Toronto to people in Edmundston, New Brunswick, and Winnipeg, and everywhere else. So you would deliver a basic income that meets, average needs across the country, and then the Ontario government, the BC government, the local communities could address those higher needs in particular regions. So in a sense, it's collaborative. What happens is that municipalities and the provinces focus on services, they focus on subsidized housing, they focus on particular issues that are unique to that community, and the federal government sets the floor. I think that's the best way to deliver the service. I don't believe that most provinces have the fiscal capacity to offer a basic income. That's not necessarily true for the bigger provinces like Ontario, like Quebec, like BC, but most of the smaller provinces simply couldn't do it. They would need the support of the federal government to offer a basic income.
Question from Tanya. Would all retired people with no income coming from having a job receive basic income payments? Would we no longer have to save for our retirement because there would be basic income?
Well, it depends how well you want to live in retirement. The basic incomes we're talking about are quite modest. In fact, the Ontario experiment was set at the level that somebody could expect to get on OAS if they got the full GIS. So a senior with no other income would receive about $17,000 a year at the time. It was set at that level because the Ontario government didn't want to include seniors in the project. They wanted to focus on working age adults, people between 18 and 64. But it would depend on the level. The Basic Income Canada proposal for $22,000 a year did include seniors, does include seniors. About saving for your retirement, I think most people hope to have more than $17,000 a year when they retire. So it depends. It depends what's necessary.
What is your opinion on Young's proposal? What are some of the positive and negative aspects of it?
Yeah, Young's freedom dividend. The proposal was that everybody, instead of the targeted basic income that we've been talking about in Canada and that I talked about today, the idea was that everybody would receive a check, and it would be taxable income, and you'd rely on the tax system to recover some of the money from higher income individuals. It's a tremendously expensive way of delivering services. We've actually done the calculations in Canada. What happens if we just cut a check for every Canadian between 18 and 64 and give them a check for $22,000? Actually, it was everybody over 18, give them a check for $22,000. If we did that, the gross cost turns out to be something like $600 billion a year. And just to put that in context, it's compared to the $23 billion a year for the one I talked about. The federal government currently spends $300 and something billion every year on everything. So we're talking about tripling federal government expenditure and tripling the tax revenue you need to pay for that kind of a program. And that's why Young is proposing a very small freedom dividend rather than enough to live on. There are benefits to that. And one of the benefits is that if everybody receives a check, it might be the case that you'd get more public support for the program. I don't buy that, frankly. I think that most people would like to see the money targeted to people who need it. People aren't fools. High-income people know that they're going to be paying more income tax in order to support a program that is paying people who don't need it money. So I'm not a big supporter. I'm a very strong supporter of a targeted basic income.
A question from Paul: is basic income a negative income tax?
Yes, the one I've proposed is a negative income tax. I didn't use that phrase because some people get confused and think that means that you get paid it once a year and it has to work through the income tax system, and that's not necessarily the case. But negative income tax is just another word for the program I proposed.
Here's an interesting question from Erin. What does a basic income look like for Indigenous communities? Would it take into account the astronomical cost of living in remote communities, or is it a blanket dollar figure for the entire country?
Yeah, I think that we've gotten a tremendous support for the idea of basic income from Indigenous communities, but I think we also recognize that we're at a time in our history where we don't impose programs on Indigenous people without the kind of consultation that's necessary to design programs for those communities. More than half of Indigenous people in Canada are actually living in cities like Winnipeg and Vancouver and Toronto and so on. And Indigenous people who live in Canada, in general, make less money than non-Indigenous people in Canada. On average, their incomes are lower, so on average, those people would benefit from the basic income to a greater extent. But if you're talking about particular communities, reserves or independent Indigenous communities, then I think it becomes incumbent upon us to consult with those communities about how best to deliver the services or how best to deliver a basic income. It's also the case that you talked about the astronomical case of food, and this is something I'm very aware of because food is incredibly costly in northern Manitoba, for example. What do we do with these remote Indigenous communities? And I think this is another thing, like the cost of rent in Vancouver or the cost of rent in Toronto. This is a local issue that provinces, the federal government, local communities need to be focused on. And I don't think that needs to be part of a basic income proposal. I think that can be dealt with addressed outside of a basic income. I think it's a special condition and a special concern that does need to be taken into account.
What are the main obstacles for Canada to implement the basic income beyond financial ones?
Well, I think finances is a big deal. I think that we do have the capacity to deliver a basic income, and I think that there's a growing recognition that it's a better way of delivering social supports than the system we have. There's always, I think that there are legitimate concerns. There are people, let me put it this way. If you've relied upon government services, they aren't services that necessarily engender a great deal of trust. And so I think that there's a legitimate fear on the part of people who've been dependent on provincial income assistance, for example, or provincial disability support, that any change might work to their disadvantage. And it's not like we don't have historical precedent that supports that point of view. So I think people are worried about change. And I think that's a legitimate fear. I think we do need to ensure that the basic income we get is the basic income we want. And we need to make sure that it's adequate to meet the needs of people. So I think that there is a fear of change. And I think that there are also people who spent a lot of time and energy building the systems that we do have in place. And it's hard for people to acknowledge that those systems might be replaced by something better. I think that there's a commitment to some of those systems. And so I think that change is hard. Those are, I think, some of the biggest obstacles we face. I think we're overcoming those obstacles. We're seeing support for basic income from many different places.
So follow-up question in line with that from Calvin. Is anyone currently leading and coordinating efforts that go beyond promoting the benefits of basic income to an action plan for change?
Yes, informally. I think that the senators have taken a leadership role in some ways. I think that there are a number of members of parliament from all parties, not from a single party, who support the concept of basic income. And I think that those discussions are happening. When you talk about an action plan for change, I'm not sure what that means. I think that there are people very involved in the discussion of what comes next, where we go from here.
So if someone wanted to join a campaign, is there such a thing as a campaign, a basic income campaign? I know there's a basic income network. Mm-hmm.
Well, that's what I was going to say. One of the best places to start is with the Basic Income Network in Canada, BICN. So if you just Google Basic Income Canada Network, you'll find a number of resources and a number of organizations that are affiliated with that particular umbrella group. And you'll find a number of people who are advocating in various directions.
A question from Ruth. We have many seniors that live on CPP and OAS, which combined provides a less than poverty line income. Would UBI replace these programs or enhance them?
Hopefully it would enhance. I think that the Canada Pension Plan is an insurance scheme, and I think there are obligations to current workers, so I can't see basic income replacing Canada Pension Plan. Whether OAS is rolled into a basic income or continues independently of it is almost immaterial as long as the programs are well coordinated with one another. If a basic income were higher than OAS, I would expect there to be a top-up for seniors to ensure that the guarantee level was met.
A couple of questions. Should there be a cost of living adjustment to basic income based on where the recipients live? And there are differently phrased questions that basically point to the same idea.
Yeah. Mm-hmm. As I said earlier, I think that differences in the cost of living have to be dealt with by the provinces and by the municipalities. They have to be dealt with locally. I think a basic income, if it were offered by the federal government, would just simply set a floor across the country. And we'd expect local governments to to adjust to local needs, to top up as necessary. Cost of living adjustment more generally, yes, I think that the basic income should be tied to the growth rate in Canada so that we ensure that everybody shares in the benefits of economic growth over time. So the basic income should increase on a regular basis as the economy grows.
A question from Michael. Would many of the current support programs be cancelled to pay for the UBI in order to end the patchwork approach we have now and make it less complicated and reduce the bureaucracy?
Yes, basic income replaces monetary benefits. It doesn't replace services. So I'm thinking of things like the Canada Workers Benefit, the various, most provinces have various tax credits in place for low-income people, the GST credit, all of these various things would be rolled into a basic income. Provincial disability support, provincial welfare programs, and so on. So many of those programs could be rolled into a basic income. As I said, whether OAS continues independently or is rolled into a basic income, it's, you know, 6 of one, half a dozen of the other. You can do it either way. But yes, that's how we would do it. We would find some of the money for a basic income through those programs. So we would eliminate that patchwork of inconsistent support.
Another question, how would savings or investments affect basic income payments?
Yeah, that's a good question. We have a number of programs in place to encourage people to save, things like the registered RESP for educational savings, RRSPs for retirement, tax-free savings accounts. We have all of those programs in place to encourage people to save. And it would be hard to argue that low-income people shouldn't take advantage of those programs or shouldn't have the opportunity to take advantage of those programs. I think that one of the real problems with the provincial income assistance schemes is that it doesn't encourage people to save. There are usually strict asset limits. So in some provinces, if you have more than $5,000 of liquid assets, for example, a bank account with more than $5,000 in it, you're not eligible for welfare. If you have a snowmobile, if you have particular assets, you wouldn't be eligible for support. And I think that those kinds of things discourage people from the kinds of forward-thinking behavior that is very good and that helps you become resilient to economic downturns. See, if you have money in the bank, you're in a much stronger position if another pandemic comes along and you find yourself out of work for a month. If you're not just a single paycheck away from homelessness, and you do that by savings. So I think that it's important to encourage people to save money. I think the concern that's being expressed is that what do we do about people who have a lot of wealth, for example, but manage to have very low incomes? And I think that the answer to that is that we can put regulations in place to ensure that we're only supporting people who need it.
Next question. How much tax are we talking about and for which brackets? The government already takes more than 40% of my dad's income, which he doesn't get back.
I agree. It takes more than 40% of my income too. I think that there are a lot of ways to raise taxes, and I think one of the worst ways is to increase marginal tax rates. So the 40% is a marginal tax rate on the last dollar he earns, the last dollar your father earns. And I think that raising that is probably not the best way to raise taxes. But one of the things the Parliamentary Budget Officer did when he looked at the cost of a basic income was to look at our income tax system, and in particular to look at a group of non-refundable tax credits and deductions that every year support people with high incomes for the most part. And he calculated that every year we're spending $122 billion. That is, we're foregoing $122 billion in tax revenue in order to create special programs, special deductions for particular groups of people, for particular kinds of investments, for particular for particular things. And one of the ways that you can raise tax revenue without increasing tax rates is to examine some of those tax exemptions and tax deductions and tax loopholes that people use. Another way of raising tax revenue is to ensure that people actually pay the taxes that they owe, to ensure that the CRA, for example, cuts fewer deals with high-income people, to allow them to not pay the taxes that they owe. So there are ways to raise tax revenue without raising tax rates. If we go back to the Ontario scheme for a minute, the net cost was $23 billion a year. One very simple way of raising tax revenue is to raise GST. Every point on the GST generates $8 billion a year of tax revenue. We used to pay a 7% GST. We now pay a 5% GST. It's not the end of the world. So there are lots of ways to raise taxes, and it doesn't mean that you're necessarily raising tax rates on high-income people.
Okay, thank you. If I may ask a question, I've been itching to ask. So in 2013, a report from Oxford estimated that about 47% of US workforce was at risk of becoming redundant due to artificial intelligence. And Paul Krugman has stated in an interview that we've always had automation throughout history, and that what's going on now is nothing new, that it's not a paradigm shift. We've gone from horses to trains, from trains to airplanes, and so on and so forth. And new industries are always being created. So do you agree with Krugman, or would you say that we are, in fact, witnessing a qualitative shift in global economies as a result of automation? Because this seems to be thoroughly relevant for basic income projects.
It absolutely is. I think it's kind of slid into the background as we focus on the current pandemic, but you're absolutely right. This focus on automation is a really important one. I'm not a believer that jobs are disappearing because of automation. I think that, like Krugman, I think that every time automation has been an issue in the economy, we've created more jobs than we've lost. On the other hand, there is a mismatch involved, right? The people who lose their jobs because of technological change very rarely have the skills that are required for all those new jobs that are being created. And that's exactly what's happening right now. So we're losing people with the old economy skills. We're losing jobs for those people. They find themselves displaced from manufacturing jobs, for example. It's hard to take a 40-year-old guy or a 50-year-old guy who's been working in a factory all his life in the manufacturing plant and turn him into a coder and expect him to move into this new economy seamlessly. And it's not just a matter of retraining. It's very hard to retrain 50-year-olds and 60-year-olds for a new kind of an economy. So what you've got is a whole lot of people displaced from jobs who lack the skills that are necessary for the new economy. And you have at the same time this group of new economy industries who lack the labor they need to offer their jobs. So you've got labor scarcity and labor redundancy at the same time. And I can say at the same time that many of the new jobs that are created are not particularly high-skilled jobs, but they're different kinds of jobs. And so you've got, for example, miners who are being displaced as the resource economy relies on less labor, fewer people to go into holes in the ground and capture commodities for sale around the world. But we've got nursing homes over here who are having trouble hiring people to work in nursing homes. Well, it's hard to take miners and turn them into nursing home attendants or personal care workers. These kinds of transitions are very, very difficult for people. And to say, well, it doesn't matter, it all washes out in the long run, ignores the fact that we only live for short periods of time. And there are going to be a whole lot of people who for a long period of their lives aren't able to take advantage of the new opportunities that emerge. And so I think one of the reasons we need a basic income is to deal with people who've been displaced over here. Yes, retrain them, but also recognize that there are limitations to the possibilities of retraining. And over here, this economy can do what it needs to do in order to move ahead. So yes, we're losing jobs, we're creating jobs, but it's the mismatch that's really important that we need to focus on.
Thank you. And then one last question. Is there a template letter available that we can access to forward to our MPs?
that's a really good idea, and I didn't think of it. And the answer is, I think no, but there should be, and I will raise that with people who are involved in the campaign. So keep your eyes on the Basic Income Canada Network website. And I should say that MPs may pay more attention to letters that are individually written that recognize your own concerns. But yes, I will pass along the suggestion that we need a template.
Okay, so keep in touch. Thank you all for your great questions. Unfortunately, we didn't get a chance to address all of them. And thank you so much, Evelyn. Just a couple of things before we end this session. You will receive a follow-up email from Zoom with an invitation to fill out a post-webinar survey. We always ask our listeners to please fill out the survey if you have a moment. We appreciate your feedback. And you can also suggest a speaker or a topic of interest to you. Also, I'd like to announce that this year, Humanist Canada is participating in a Great Canadian Giving Challenge fundraising campaign. We're funding our Public Humanities program, which includes monthly webinars and new Public Humanities courses. Your donation will get us closer to winning a $20,000 prize. And for every dollar you donate to us in the month of June, counts as a ballot. To learn more about our courses, please follow the link in the post-webinar email that you will receive. And on behalf of today's webinar team, myself, Martin Frith, and our presenter, Professor Forget, thank you all for joining us. Thank you very much, Evelyn, for your wonderful presentation. And stay safe and connected.
Thank you.
Thank you.